Cardiac output is the volume of blood leaving the heart in 1 minute. The formula for calculating cardiac output is stroke volume times heart rate. If you remember, stroke volume is the volume of blood leaving the heart in 1 heartbeat. So if you multiply that with the number of beats per minute, you have cardiac output. Let's look at the relationship between stroke volume, heart rate, and cardiac output. When stroke volume increases, cardiac output also increases. When heart rate increases, the cardiac output also increases. We all understand heart rate, but stroke volume is a little bit more difficult to understand. There are 3 factors that affect stroke volume. One of them is called preload. This is the amount of blood that actually reaches the ventricles. If more blood comes back to the heart, more blood will reach the ventricle. We call this venous return. So preload is determined by venous return. When you exercise, more blood returns via the superior and inferior vena cava into the right atrium and therefore into the right ventricle. Same thing on the left side. More blood comes back to the ventricles. So when preload increases, stroke volume increases as well. And when preload decreases, stroke volume decreases as well. The next factor is contractility. You may have noticed that when you exercise, your heart beats more forcefully. This force of contraction, when it increases, forces more blood out of the heart or out of the ventricles during each heartbeat. So the greater the force of contraction of the heart, the greater the stroke volume. The third factor that affects stroke volume actually lowers stroke volume. It has a negative effect, and that is afterload. Afterload is not an issue for most people. For most healthy people, afterload is not an issue. However, in some people who have high blood pressure in their great arteries, then this pressure does not allow the ventricles to pump the blood out as efficiently, and so it has a negative effect on stroke volume. Let's apply this to a real-world situation. How does exercise increase cardiac output? This is important because exercise increases the oxygen demands of your body. So let's look at this step by step. When you exercise, your joints and muscles become aware that there has been some kind of movement. This movement is actually picked up by very specific receptors called proprioceptors. The proprioceptors pick up your activity and they become stimulated, and they in turn activate the medulla oblongata. The medulla oblongata in turn activates the sympathetic nervous system. If you remember, the sympathetic nervous system is always turned on when you exercise or when you are in some type of emergency situation. The sympathetic nervous system has an effect on the heart. As we know, the heart beats faster. So let's take a look at that. It has 2 effects, the sympathetic nervous system. It makes the heart beat faster, and it also makes the heart beat more forcefully. So when the heart rate goes up, it automatically increases cardiac output. So we have those up arrows. Heart rate goes up and cardiac output goes up. What about the force of contraction? So the sympathetic nervous system also makes the contractility go up. So when contractility goes up, it increases the stroke volume. So stroke volume increases as well. As we know, when stroke volume increases, cardiac output also increases. There's yet another way that exercise can increase cardiac output, and that is via venous return. When we exercise, more blood returns to the heart, so the venous return goes up. When venous return increases, preload increases. And as we just learned, preload is a factor that positively affects stroke volume. When preload goes up, stroke volume goes up as well. So here we have it. Cardiac output goes up because heart rate goes up. Cardiac output goes up because stroke volume goes up. And exercise increases all of these. The stroke volume must be equal on both sides of the heart. This means that the ventricular output from the right side must be equal to the ventricular output from the left side. Usually, stroke volume in a normal situation is 70 milliliters. So it has to be equal on both sides. If it is not equal, then the result is edema or fluid accumulation. So we need to remember this. Stroke volume cannot be unequal. So here's an example of what happens when the right side is pumping more than the left. The right side is shown by the solid arrow and the left side is shown by the dotted arrow. If the stroke volume on the right side of the heart is greater than stroke volume on the left, then the blood that's being pumped to the lungs from the right side is much more, and so fluid accumulates in the lungs, causing pulmonary edema. The cause for this might be that the left side of the heart is damaged. So there you see the pink cross there shows you the damaged left side. The opposite is true for systemic edema. So let's see, when the left side pumps more than the right side, then the result is systemic edema. Remember, the left side is pumping to the body, so the edema ends up in the body. So if the stroke volume on the left side is greater than the stroke volume on the right, the result is fluid accumulation in the body, otherwise known as systemic edema. Now in this case, because the left is pumping more, the problem probably arose on the right side. So there was probably a damage on the right side of the heart. Let's imagine that you are treating a patient who has recently suffered a heart attack and now has pulmonary edema. So let's see how a heart attack can lead to pulmonary edema based on what you've just learned. So here's the heart attack, which is the real cause of the pulmonary edema. The heart attack may have affected the left side of the heart. So the left side is damaged. So damage to the left ventricle, which would lead to the right ventricular output being greater than the left ventricular output. So essentially we have unequal stroke volume. When the right ventricular output is greater than the left ventricular output, fluid accumulates in the lungs, which is basically pulmonary edema. Now let's imagine you have another patient, and this patient also has suffered a heart attack, but this patient has systemic edema as a result of this. Let's take a look at how a heart attack can lead to systemic edema. So here we have it, heart attack. So the damage would be on the right side, damage to the right ventricle, leading to left ventricular output being greater than right ventricular output, essentially unequal stroke volume, with the left side pumping more. That would lead to fluid accumulation in the body because the left side is pumping to the body. Another word for that is systemic edema.